Hello, my name is Aaron Mills. I'm a doctor of acupuncture and Chinese medicine at University of California, San Francisco, Osher Center for Integrative Health. And so today I'm going to be talking about acupuncture and the treatment and management of chronic health conditions. So I guess the first question would be, what is acupuncture? And most people would ask if it's painful. And the answer would be no, it typically is not painful. It's using very, very, very fine, individually sterilized microfilament stainless steel needles that are solid and inserting them into known parts of the body, utilizing and based upon East Asian medicine theory of medicine. And East Asian medicine theory is a system of medicine that dates back some 3,500 years. And how it works, the explanation would be wound healing, conceptually causing microtraumas to stimulate innate healing through the nervous, immune, and endocrine systems. And it's a natural painkiller. There's a feedback loop signal from the peripheral nervous system and the central nervous system that releases endorphins, norepinephrine, enkephalins, and endogenous opioids. It reduces the intensity and perception of pain and involves the serotonergic nervous system to do that. It also reduces stress, and one of the means is releasing oxytocin, which is a hormone that stimulates the peripheral nervous system to calm, connect, rest, and digest, which is largely implicated in autoimmune diseases, for example, IBS. In managing or treating chronic health conditions, the conditions commonly treated are anxiety, depression, PTSD, GI issues to include IBS, IBD, constipation, diarrhea, and GERD or acid reflux, chronic pain, including musculoskeletal pain and neurological-based pain. In neuro, it benefits patients that have motor and sensory deficits. And in cancer as well, as with many other complex internal medical conditions. And regarding the treatment and management of these conditions, in some instances, acupuncture is effective in treating symptoms associated with the condition as well as treating the underlying cause. An example would be anxiety or depression, headaches, GI issues, and pain. Yet in other instances, acupuncture effectively manages acute phase or chronic signs and symptoms associated with the condition that is primarily being treated by allopathic medical care. And that would include cancer, chronic mental illness, traumatic brain injuries, and long COVID. Acupuncture restores homeostasis and reduces inflammation. Inflammation is a significant factor that contributes to chronic diseases and their development. And there's acute inflammation, which you would know is when you have a trauma, the inflammation that occurs around that wound or something of this nature. Chronic inflammation typically would be more internal medicine and systemically associated. And diseases associated with chronic inflammation are cancer, heart disease, rheumatoid arthritis, type 2 diabetes, obesity, asthma, cognitive decline and dementias in older adults. The therapeutic potential exists in chronic inflammation related to acupuncture. It's effective in treatment of chronic inflammation associated with disorders such as allergic rhinitis, anxiety, asthma, atherosclerosis, and other cardiac associated conditions, cancer pain, rheumatoid arthritis, stress, and Crohn's disease. Research also indicates the intervention is considered systemically effective and safe in the management of diseases associated with various regions throughout the human body. And so how do we do this? Well, in integrative medicine, we work in a collaborative care environment. So here's a picture of us all, many of us in the clinic, at an outing that we went to Chinatown to go to study an herb historical museum and kind of dig into the cultural heritage as well as the herbal medicines themselves. And this is a multidisciplinary effort. And so you have integrative psychiatry, oncology, general medicine, physical therapy, pediatrics, all, attending this, and, everyone's having interest as well as staff at the center being exposed. I can think of one patient particularly that has comorbidity of multiple myeloma, PTSD, long COVID, chronic pain syndrome, and Hashimoto's, who's being seen by integrative oncology, integrative psychiatry, integrative general medicine, integrative physical therapy, as well as the services that I offer, and has been thriving over a period of multiple years. In fact, based on the outcomes, she was assigned acupuncture at the VA because of the improvement in her health outcomes and the maintenance that's been going on. At this point, her levels are good with the multiple myeloma, and she's been managing her behavior, and the PTSD and anxiety have been at bay as well. So people would ask, how do you access acupuncture? And that brings up the issue of barriers. So often there can be socioeconomic barriers to access to care. And so some 50% of those can associate with your zip code, your physical environment. So that's related to income, of course, family and social supports, job status, and education level, whether or not people were able to access. However, at the same point, 30% of health outcomes are driven by modifiable behaviors. And so this is smoking, diet, exercise, health risk behaviors, and which we mitigated by things that an individual can change in relationship to them. So if you find yourself trying to access services and they're not in your area, or you don't have the ability to get access to them because of insurance and or financial issues, look to community organizations, because often they have free information. They are also teaching mindfulness and wellness to people so they can start to work with these modifiable behaviors. And then look for your local area, to find somebody that is in private practice that may work with people and be able to take you on in a community-based setting, and community acupuncture itself as a model doing that. Because 20% of the health outcomes is actually associated with which would be healthcare access. Then that's access to quality healthcare. And so again, you can look for modifiable behaviors that you could change to help you and support your health condition, as well as look for community resources while you're waiting. Most acupuncturists are in private practice settings. And so there should be people that are available, but that's not, that always depends on your zip code. And integrative health services, of course, offer a comprehensive solution to your individualized health concern. And so acupuncturists focus heavily on prevention of chronic health conditions through lifestyle, diet, movement, herbal medicine, and supplements. But you would need to talk to your primary healthcare provider to let them know that you're working with somebody, or you're interested in working with an acupuncturist, and they would be able to work collaboratively with them through release of information so that they could exchange information regarding, your health status. And so that would be an effective way to get that happening as well. If you're with an acupuncturist, ask them if they do work with primary care providers, and many do. Many people are, working with allopathic medical providers and have professional and collegial relationships with them, where they do manage people's care and co-manage people's care. And thank you very much for your time today.
Today we will be talking about how manual therapy can help with chronic pain. Thank you for joining us today. I'm Selim Sheikh. I work at the University of Utah Huntsman Cancer Institute Wellness and Integrative Health Center. I am trained as a family physician and a lifestyle medicine physician. At the Wellness Center, I see consults for osteopathic manipulative medicine and lifestyle medicine.
My name's Benjamin Smith. I'm a wellness education research and training coordinator, also at Huntsman Cancer Institute. I'm also a massage therapist, and I see patients, outpatient who are coming in from the community, and inpatient who are staying in the hospital. And I manage a team of 11 massage therapists here in a comprehensive cancer setting.
Today we will cover the basics of massage therapy and osteopathic manipulative treatment, or OMT, and how these modalities can be helpful in treating chronic pain. We will also touch on the team-based approach in our Wellness Center as an example of how different approaches can work together for better patient care. I'll briefly discuss chronic pain here. Chronic pain is pain that persists or recurs beyond 3 months, which is the usual time of healing for many conditions. It can be caused by a variety of conditions, including injury, disease, or may even occur without a clear cause. It affects both the body and mind and is influenced by biological, psychological, and social factors. It affects 1 in 5 adults in the United States and can interfere with all aspects of daily life. Effective treatment must be individualized and should draw from both conventional approaches like medications, as well as non-medication-based approaches such as exercise, talk therapy, mindfulness-based therapies, physical therapy, acupuncture, body-based modalities like massage, and osteopathic manipulative treatment, and others.
So one of these complementary approaches, massage therapy, is defined as the systematic manipulation of the body's soft tissues, which includes muscles, tendons, fascia, with the intention of enhancing health, meeting participants' health goals, reducing stress, improving function. Massage therapists are typically trained for about a year and are licensed by the state. And while we can address symptoms generally, we don't diagnose or treat any medical condition. And what we do hands-on excludes spinal manipulations. We don't do any popping or cracking that maybe like a chiropractor or physical therapist would do. And typically our approaches are non-painful and they're not aggressive. There's two major ways that people participate in massage or the massage therapy is provided. One context is in supportive approaches that are focused on general well-being and relaxation, typically focused on the whole body, and often involve these long gliding strokes called effleurage directly on the skin. But there are other approaches that can be provided, like through clothing. And it's important that massage is provided in individualized context as well. The other kind of bucket or context is these targeted approaches where massage therapists are trained with specific techniques like myofascial release or trigger point therapy, where they can focus on a specific joint or a specific area where you might be experiencing pain or restriction or reduced function in order to improve overall function or reduce pain locally. Some folks find this targeted approach more meaningful or beneficial for chronic pain, but sometimes people with chronic pain that feels really localized actually benefits better from like a general or full body approach. It's really individual and subjective. And so participants have to work together in participation with massage therapy to find what works best for your body. So how does massage therapy work? Well, luckily it affects the whole person. So it has these physical or localized effects. It affects people physiologically and psychologically, and there are even elements of massage that may affect people socially, starting with a felt sense of safety. Massage works best when it's comfortable, it's delivered in a way that makes sense to the participant, and that is explicitly shared between the therapist and the participant. So having a good conversation beforehand goes a long way. Doesn't need to hurt to be effective. We have these kind of top-down benefits and we have these bottom-up benefits. The top-down benefits, meaning coming from the brain and the central nervous system or affecting the whole person top-down, come from the fact that massage helps people feel generally better, regulates mood, and helps the nervous system, meaning shifts people into a state of rest and digest rather than fight or flight, and might help people connect with their body in a more safe way to help them self-regulate. So maybe be more aware of bodily cues that maybe you're starting to overdo it or that something's starting to hurt, and maybe you can move towards relief in a productive way. And then these bottom-up approaches, massage seems to help with localized pain, can help with circulation and moving lymphatic fluid or reducing muscle tension. And then there's this other cool thing where these long gliding strokes stimulate special nerves called C-tactile fibers that send a message of safety and relaxation from the soft tissues up to the brain and can interfere with pain signal.
So what is osteopathic manipulative treatment, or OMT? OMT is a hands-on modality used by licensed physicians to get your body moving as close to normal as possible. It involves the use of the physician's hands to apply gentle pressure, stretching, and specific movements to muscles and joints to improve mobility, relieve pain, and support the body's natural ability to heal itself. In a way, physicians who use OMT are like mechanics for the human body, akin to taking your vehicle in for a tire realignment. It is a whole body approach and works to help a dysfunctional body part move in harmony with the rest of the body system, just like how beams and cables function together in the structure of a bridge. While it is a Western medical treatment, it differs from most other traditional therapies in that it not only targets the disease, but also strengthens the host. So how can it help with chronic pain? It is a personalized medical treatment as it is based on specific physical dysfunctions, which differ from patient to patient. It can cure certain conditions, such as minor whiplash from a car accident. It can help control chronic conditions, such as arthritis, by reducing pain flares. It can also be palliative, such as in treating patients with cancer-related pain. It can target the areas of the body that are the most affected by chronic pain, such as muscle, joints, or the nervous system. It may also improve sleep quality and reduce feelings of fatigue and depression in people with chronic pain. OMT can be used alongside other therapies for a more complete approach to chronic pain.
So, in my context and role at Huntsman Cancer Institute, I get to be part of this massage therapy team, and we're focused on massage therapy for inpatient and outpatient populations. And we also get to participate in NIH-funded clinical trials looking at the mechanism of action for massage, specifically for populations of cancer survivors and populations of people living with generalized anxiety disorder. Prior findings from this research group have found clinically significant changes in reducing anxiety, reducing pain, reducing fatigue, and we're continuing to explore why that is in the through neuroimaging and looking at the autonomic nervous system. And our purpose is to help patients manage the emotional and physical side effects of cancer using evidence-informed practices.
So where can you learn more? You can learn more about massage therapy and OMT at these sites, which also include searchable data directories for practitioners near you. Massage therapy is most commonly cash-based, and OMT is usually accepted by insurance.
And while massage therapy isn't typically covered by health insurance, sometimes it can be covered in the cases of like motor vehicle accidents through auto insurance. And other ways to access it could include getting a letter of medical necessity from a primary care doctor to allow you to use any funds you might have in an FSA or HSA, which might be able to be used for cash-based services like massage.
Here are some billing codes that are typically used in case you would like to check with your insurance plan for coverage. And in case you don't have massage or OMT available to you, here are several other approaches that are effective therapies for chronic pain. At our center, in addition to massage therapy and OMT, we offer a wide variety of wellness and integrative health services, including acupuncture, exercise counseling, nutrition consultations, and music therapy. Thank you for your attention.
Hi, my name is Betsey Nuseibeh, and I'm part of the Osher Center for Integrative Health at the University of Cincinnati. I'm a music therapist, and my work focuses on how music, and especially singing, can help reduce stress. I've been working in the field of music and music therapy for about 20 years, and along the way, I've seen how powerful music can be in supporting health and well-being. Right now, I'm completing my PhD in the School of Public Health at Indiana University, and I'll be defending my dissertation this December. So today we're going to talk a little bit about stress and how it shows up in the body and how vocalizing and singing might help us to manage that stress. Yeah. So stress, ugh. We all live with it. For some of us, it shows up as a racing heart. For others, it's tight shoulders. For some of us, it's those endless 2 a.m. thoughts that don't let us go back to sleep when we wake up in the middle of the night. But here's the important part. Stress itself isn't necessarily the problem. The real problem comes when we don't allow our bodies to complete the stress cycle. So, you see, our bodies are wired to handle stress in a cycle. When things are calm, we breathe and our heart beats at a relaxed pace. But when a stressor hits, our sympathetic response, our fight or flight systems, they kick in and our heart rate speeds up and our breathing gets faster to help us deal with that stress. And then once we have worked through it or dealt with it, we naturally settle back to our baseline. But now, if you look at the right with the chronic stress response, if we're already stressed and another challenge arrives, our brakes can't keep up with the accelerator. So those faster breaths and racing heartbeats, they stick around. And they might even lead to things like headaches, symptoms of anxiety, maybe low mood, and some other long-term stress symptoms. Now, here's where I start to kind of get a little excited, because singing as an intervention, it might be a solution to help us complete that stress cycle and reach homeostatic balance from which we're better able to evaluate stress. So when we're in that state of calm, of balance, the time between our regular heartbeats is greater. We say we have a higher heart rate variability, and our body is in a relaxed state. So when a stressor hits, it seems more manageable. You can see that blue line under happy. There's a nice variation between beats and a heart rate range of about 60 to 80 beats a minute. But when we're stressed or imbalanced, you can see that the heart's beating faster, up to 90 beats a minute, and the cycles are much shorter with lower variability between those heartbeats. Now, on the right are figures that represent a small sample of 5 singers from a study that was done in Sweden. Their heart rate was evaluated at baseline, and then while they were humming, singing a mantra or a chant, and singing a hymn. And their baseline, while not necessarily stressed, is closer to the picture that indicates a body primed and ready for action. But now take a look at the humming, the chant singing, and even a little bit of the hymn singing. You can see pictures that are closer to those that depict a happy or calm body at rest that's ready to evaluate the stressors that life sends. Now, scientists have a few ideas as to why this might be happening. Many believe that it's the respiration rate, those inhalations followed by slow, long exhalations that are required by vocalizing and singing. That might be one of the reasons. It also might be the act of doing this with other people. And it might be the pitches resonating between the singers. It just kind of depends on which study that you read. So now, with the image of that stress cycle and the potential for our voices to kind of help us complete that cycle, let's try it together. Let's take a moment to find out how humming and singing makes you feel. And so, we'll give ourselves a moment. And I'll invite you to join me in a vocalizing exercise, humming and toning. And as we do, please just pause for a moment with me. Place a hand on your chest, or maybe your belly, and just start to notice your natural breath. And as you begin to notice this breath, the steady inhale and exhale, begin to ground yourself in your chair. Maybe you uncross your legs and arms and feel your 2 feet flat on the floor. Maybe you wiggle your toes so that all 4 corners of your feet are touching the floor and you're truly grounded. Keep breathing in, out. Our breath, which we're so focused on in this moment, it's connected to our voice. And when we use them together, it can help bring mindful attention to our bodies. And when we use them together, I invite you to breathe in through your nose, and on your exhale now, begin to hum. Remember, relax your facial muscles, relax your body. You might want to place the tip of your tongue behind the bottom of your front teeth. Maybe as you hum the sound, you'll feel your face muscles relax more and start to relieve the tension in your face and your throat. Maybe you experiment with higher and lower tones to kind of find what feels good and produces the right amount of vibrations for your body. Some of you might like a lot, and some of you might like a little less. You might want to lightly place your fingers on your cheekbones to kind of feel those vibrations externally. Just really let the tension slide out of your jaw and your face. Relax your face muscles and just feel the energy of the hum in your body. And now, as you had a little preview earlier, on your next exhale, slowly open your lips. We're not concerned with a specific pitch, just a sort of high or low in our bodies. We have that chest area. Ah. Or we might feel it in our sinuses. Or our belly with a nice big round ooh. So just try those a little bit and feel around in your body for which one kind of resonates with you the most. So this mindful humming and toning that we're trying here, physically, it can decrease our heart rate, it can lower blood pressure, and it can focus and clarify our mind and help us decrease our stress and anxiety. Some of this might be due to the respiratory and circulatory changes in the body that are initiated by singing. Also, we're focused in the moment on the sound production that we need to have when we're using our breath, right? In this way. And so now, as we begin to end our time together, I'd like to try singing a mantra with you, a mantra or a chant. So when we're simply being, our breath rate is about 15 breaths a minute. But interestingly, when we chant or sing a mantra like this, our breath seems to slow to about 6 breaths a minute. And this is really a key respiration rate, and aligning with this has shown to improve respiratory and circulatory function. So the song we're going to try today is called Common Ground. I'm going to take it at a tempo where we're at about a 6 to 8 breaths cycle, 6 to 8 second cycle with our breath. I think it'll allow us to get the feeling of breathing together, of singing together, and really experiencing that sense of community. So before we head into this song, I would like to thank you for trying these vocal exercises with me today. And maybe the next time you are breathing a little more quickly or you're feeling a little stressed, I might invite you to try humming with a song or singing the chorus. And while you're focusing on your breath and those exhalations, maybe observe what it does for your stress levels. Go. So breathe. Take my life onto common ground. Take my life onto common ground. Take my life onto common ground, so my life can grow on a higher, peaceful ground. Thank you.
I feel like I've taken advantage of all of the modalities at Osher.
Acupuncture, they helped for me. PT, OT also has helped a lot.
Love my acupuncture. I look so forward to it. I come out of there and I feel in alignment again. I feel more peaceful. I feel like my body is a little more at ease. It just gives me the chill factor that I love and my body seems to love.
The acupuncture was tough for me because making it into the office was a little hard for me, but I was able to do 3 or 4.
I live close to a community acupuncture, so I try to go there once a week or twice a month. That really helps.
I was going into physical therapy and thinking I was going to be judged based on what I couldn't do or what I should be doing. Because there are days where I can move my head a little bit and there's the days I can move it a little bit more. And she worked within that, allowing me to just do what I can. And it was the same with occupational therapy. She told me it is okay that taking care of yourself is a full-time job. And that blew me away. Because taking care of myself is a full-time job.
Physical therapist that I have worked with for years is just, it's just different. It's different and it's extremely effective.
I don't know what my path would be like without acupuncture, but I've loved my path with acupuncture and the whole notion of bringing in traditional Chinese medicine and another way of thinking. And I didn't know I would continue acupuncture so long after chemotherapy, but I feel like it helps me so much that I may continue it forever.
Music can be healing too. I listen to Paul Isaac, and his music has been a big part, I feel like, in my managing of headaches and my overall mood too. I strongly recommend just like finding music that inspires you.